Hello, and I don't know, is it morning or good afternoon? But anyway, I'm happy to welcome you to our workshop. And workshop is organized by the Innovation Networks for Active and Healthy Aging project. It's a project about how to scale up solutions for elderly people, for them to stay at home as long as they wish to, and to stay at home happily, securely, and in a good condition. Today's topic is data management challenges in the health and care sector. So it's really about that organizations can share, protect, use, and be accountable of the data it needs to value creation. So for all the stakeholders, data could be and should be something that creates value on top of their services. Service providers in the health and care domain understand the importance of data management, but may experience problems to understand where the data lives and how to access it. Put in place safeguards to protect data from threats of inappropriate use, and develop the right processes and capabilities to manage data lifecycle. Today's workshop is not like the launch of the process. There has been a survey in the past, a few months ago, where we collected input from stakeholders. There has been focus group interviews to collect input from stakeholders. And also today's workshop is not the end of the process. Today we are going through the state of art we have right now, and we would like to have really fruitful discussions with all of you to create as valuable data management approach in this project as we can, together with you. And I'm not alone here today. Together with me, there is also Hille Hinsberg. And Hille is one of our project partners from Proud Engineers. And Hille's task is to moderate today's event and also to guide you through the breakout rooms later on we have. But let me introduce you the agenda of the day. So after I finish here, I will hand over the screen and microphone to Andres Kütt, also from Proud Engineers. And Andres will really go in depth and discuss the topics. What is the business value data can provide? What would a data governance strategy look like? How to manage people, technology, and processes, all the really, really important questions. And after Andres's presentation, we will have a short Q&A session. Also, you can drop your questions straight on right already now to this Zoom chat box. And Hille will moderate the Q&A session. And after that, we will divide you to breakout rooms to have even more detailed discussion how to create the framework we really need. So I guess that we are ready to start. Andres, you are ready?
Yes, hello everybody.
Okay, Andres, so the screen is yours.
Which Andres? I do hope it's me.
Yeah. I'm sorry.
I have no problem with handing over to Andres Kuke as well. He's an excellent speaker and very knowledgeable on the subject.
Yeah, but this time I meant Andres Kütt. Next time it can be Andres Kuke as well. So, but yeah, Andres Kütt. Thank you.
Right. If I could get the permission to share screen. Yes. Share this one. Yeah. Is my screen visible? Am I audible? Am I visible?
Yeah, everything's good. Yeah.
Awesome. Let's get going then. So we are working on a data management guidebook. And the goals for today, for this session that I'm bringing forth, are threefold. Firstly, to give you guys an overview of the main ideas behind the guidebook. Just cover the basic principles that we are using to develop the guidebook that we are working on. Then I'd like to walk you through the proposed content as to what we are putting in the guidebook and how that's going to be structured. And then, which is the most important part and couldn't be done without the first two steps being completed, is to gather feedback, because we could sit down and write anything really, from prose to poetry, but it's only going to be useful if it's useful to you. So it would be very, very important for us to receive your feedback, your thoughts, your comments, and the entire sort of breakout session is also focused on these sorts of topics. So any feedback and questions and comments would be very welcome. So the main ideas behind the guidebook are that the goal is to be brief, practical, specific to the active and healthy aging sort of entire sort of topic, but also general in terms of geography in the European context. So it's quite obvious that the goals are very tricky. How can I be both brief and also general and cover the entire European context while also being specific without actually going into details? But I mean, the health data exchange, for example, very practical things that one must do to gain access to health data in Estonia versus in Denmark versus in I don't know, Bavaria are going to be very, very different. So it's going to be a challenge to develop this guidebook in a fashion that actually fulfills those goals in any sensible way. Again, and this emphasizes the need for input from the field. What is it that the practitioners find valuable in the guidebooks? What are the questions that they have? What do you want to see in that guidebook? So we're really, really looking for that feedback at this stage. The aim of that guidebook that we are writing is to provide a useful mental model for thinking about data management and then fill it with practical advice in implementing it. The thing is that just starting to pile up practical advice on how do you connect your local network of healthcare processors, or how do you talk to your local regulator, or what European standards to look forward to look towards, it's not going to make a whole lot of sense. There might be a sort of this some good nuggets of information in there, but it's not going to form a sort of this holistic sort of model unless there's a mental model underneath it. And so the mental model we are going to provide is going to sort of serve as this structure into which the practical advice can be sort of slotted. It's a blueprint, like this is how these practical elements sort of all fit together. But also the mental model is intended to be useful in situations that we cannot possibly cover in the guidebook. For example, if there's a country-specific set of regulations, then we can't give advice to how do you work with this specific requirement, this specific government body in your target market has. Or if there's a specific area-specific kind of, like, for example, if the way radiology images are shared in a particular context is very standardized and very specific, requires specific permissions or consents or what have you, then we can't give specific advice on these sorts of things. But if there's what we can do is we can give you a sort of mental model. So how do I think about this situation? How do I approach the situation in my organization context, and how do I think about it as in terms of data management? So that's the second goal of the mental model we're going to be providing within the guidebook. And the model that we're using is thus. In this way of thinking, the data management, and this is but one model, and as the saying goes among statisticians, all models are wrong, but some models are useful. And this is certainly not a sort of comprehensive model explaining the life, the universe, and everything. But it's something that we found useful previously. And this model revolves around basically data strategy that explains or formulates for this given organization, how do you gain business value? How do you approach implementing people, processes, and technology to gain control over data, allowing you to execute governance on data that you process? That the data strategy is the centerpiece of this model. And around the data strategy, there evolves this nice feedback loop where there's business value, which can be directed via internal value capture. You can budget it, you can have a specific investment goal, what have you. You can direct that business value towards people, processes, and technology. Invest building out the specific competence frameworks, training people, implementing data management processes, acquiring technology, installing technology, learning to use technology, and so on and so forth. And all of those things require investment. But these things enable you to gain control over data, meaning that you have an ability to decide who gets access, for example, to the data. You have the ability to control where this data is processed. It's quite difficult to control something that you don't have an understanding of, for example. So control is all about having that understanding, being able to sort of systematically make decisions about it, and so on and so forth. Control is also about risk, but because a data breach, when somebody breaks into your servers and makes off with your medical records, or the medical records that you're storing in your organization, that's basically loss of control. You no longer control who has access to this data because the data has been posted, God knows where, in the dark web. So, and having control of your data really enables data governance. Think of it as having sheep. Unless you can actually catch the sheep and manage to sort of tell them where to go and sort of bring them all in one place together and sort of basically control them, you're not going to be able to extract value from them. You can't share a sheep that you can't catch. So control is prerequisite for governance, be it consent management, be it other value creation processes, or value enabling processes rather. And this ability to govern your data enables value capture. This is out of the scope of the model because we don't know what your business model is. It might be that you are selling this data to researchers. It might be that the data you are processing gets shared with a customer, and the business model revolves around customers being shown ads or paying a subscription or whatever. The way it is that you turn your ability to govern your data into value, that is externally captured. You bill your customers, you get payment from the government. Whichever way you capture the value, this value then in turn is directed back towards the business value that can again be turned into investment into people, process, technology. And so basically the idea is that you should be able to set up a structure in which the more you invest into people, processes, and technology, the more control you have over data, the better governance processes you might have in place, the more value you can create, the more value there is to be captured, and the more value you can direct back towards the people, processes, and technology, creating this virtuous cycle that helps you to do data governance or data management rather in a sustainable fashion. So it's not a one-off endeavor where you open up the guidebook and go, oh, I should be really doing metadata management, and then you install a piece of software and maybe gather information about a few data sets and it remains there, yielding not much value. The goal is to give you guys understanding as to how do you make this sustainable, how do you make this something that goes on in your organization for a long period of time, hopefully throughout the life cycle of your entire organization. So that's the data management model that we are going to be using. And the proposed content of the guidebook is really divided into two parts. Firstly, we will explain the data management model and its elements in much more detail than I went through right now, but the gist is going to be the same. Basically, this gives you information as to why is the practical section structured the way it is structured. And secondly, how do I make sense of how elements of the data management relate to my business goals? So how do I sort of take those sort of steps or elements of data management, the people, process, technology, control over data, data governance, how do I relate those to the strategic goals of your organization? Because data management in itself doesn't yield value. Just managing your data, having a metadata repository in itself, it doesn't help you achieve your strategic goals. It's not really useful. Why you should be spending resources on something that doesn't really sort of help you achieve your strategic goals. And this mental model we have discussed briefly allows you to build that relationship between what your organization tries to achieve in a strategic fashion and the data that it has and the data management steps it undertakes to manage the data. And secondly, the second part of the document is focused on actually implementing the data management model. Okay, so now I understand the theory, how things should be working, what's my approach to this. But what does it mean? What does it mean to gain control over data? Oh, there are risks. Okay, so what are the basic practical risk management tools that I can implement? So the first thing is in that section is to give you guys the practical things you should be doing about data management. We're trying to be very practical as much as we can in our sort of general but specific kind of framework that the guidebook goals prescribe us. But secondly, what we're trying to do is to allow you to give you guys the tools to understand where are you on this journey. Like if I have these data sets roughly, and if I do have this contract with a cybersecurity company that does sort of reviews once a year, is that okay? Is that sufficient? Or should I be investing more into cybersecurity or less? How do I know if my people, processes, and tools are on par? Like where they need to be. So we also seek to provide this kind of self-assessment tooling along with the practical advice to actually sort of allow you to gauge whether this advice even is relevant to you. Because if your assessment comes out with all fives and all highest scores, then maybe like implementing however good advice on top of what you're already doing isn't really going to drive much value. But if you find that the specific area is lacking, maybe the advice in that area is more relevant to you, and this also allows you to get this better understanding as to what parts of the guidebook are more relevant to you. All right. So going into a bit more detail, the proposed structure is thus of the guidebook. So the first part, the data management model, is in turn divided into three. Firstly, we talk about business value. What are the ways data can be used to create value? What are the different sort of approaches or different ways to think about business value in the data context? Are you after gaining new knowledge or new information? Are you after reducing waste? All those concepts of creating business value out of data, we are trying to sort of briefly capture there. Secondly, data strategy. Remember the central point of our model, that everything revolves around. What does a good data strategy look like? And what guidance is there for health services? This is a very tricky area because strategy doesn't have established theory behind it, and it's all sort of this hand waving and kind of historical evidence. But what we will try to do is we will try to present a framework to think about what does a good strategy look like, what are the properties of a good strategy, and also link that to the specific guidance that is there for healthcare services and health data services in the European context, because various sort of examples of data strategy or various guidance to around creating data strategy is available specific to the sector. So we are linking to those. By the way, this is going to be a recurring theme in the document of ours, is that we always try to refer to external sources whenever relevant, and reinvent as few wheels as we possibly can, because we do know that, and to understand that there's a huge amount of information available, and so if there's a good source that we know of, we will just simply refer to that and not try to sort of recreate that content within the context of our guidebook. And this should allow the reader to actually sort of get this high-level overview and then go into details, whether that's a specific regulation or guidance on specific data strategy area or what have you. We're always trying to sort of find the good sources and refer to them, also in terms of self-assessment. And the third part of the part one of the guidebook is the data governance model. We explain now the elements of the model that we just saw on the screen. What are the elements, how they connect, how they relate, and how should the feedback cycle work, where more investment into better data governance leads to more value to be invested back into data governance, and how to make that cycle work in a sustainable fashion. The second part of the guidebook talks about practical advice, as discussed previously. And it's divided into 5 different sections. Firstly, we talk about internal value capture. How do I go about investing in people, process, and technology for data management? What's the practical guidance there? How do I know if I've invested enough? How do I know if I'm overinvested, underinvesting? What are the consequences? How do I capture the value? Because the thing is that data management can be often seen as this abstract, weird kind of thing that people do that isn't really related to the customers paying their bills. So the expenses occur in one business unit, can occur in one business unit, and the revenue appears in a different business unit. So how do we link these two together and ensure that there's still this investment flow towards enabling what attracted the customers to us maybe in the first place, so that they can pay the bills later? Secondly, we discuss the people, processes, and technology part of the model. What are the tools that the organization needs to gain control over the data it processes? What are the competencies? What are the processes that should be in place? What technological elements should be there? What tooling, sort of like technically, should be there to allow an organization to be in control of its data? And then we talk about control. What does it mean? And how do I know that I'm in control of my data? And what are the concepts there? And because control is directly related to risk as well, then this is where we discuss various specific ideas on how to think about risk and how to implement risk control processes, cybersecurity, how to, for example, incident response. We are not going to give you sort of this deep dive guidance on this is how you do incident response. But we can give you sort of specific things that if there's an incident, then you should be doing these things. These sorts of advice we can definitely give you, because cybersecurity in itself is a deep area, and we're not even scratching the surface with this. But in this guidebook context, in the data management context, we're trying to give you guys some pointers as to what are the basic things that should be in place. And then governance. So how do I utilize the data my organization controls for value generation? How do I do consent management? How do I do access management? These sorts of things. And finally, context. Data management never happens in a vacuum, and no organization really operates in a vacuum. And so how all of this practical advice links to its context in terms of organizational, legal processes, and so on and so forth is really crucial to make this mechanism work. So in this section, we try to give advice, how do I make this thing that works in my organization, this data management process in my organization, how do I make this work in the business context with all the stakeholders, with the regulators, with the cybersecurity community, with the patients, with the healthcare providers? How do I make it work in that context? And now is question time, because that's all the guidebook is about. And I'm very curious to hear as to what questions you might have about this, or what might the comments be.
So please, after this short introduction that my colleague Andres made, we are now very happy to receive your questions. I can see that there aren't that many in the chat, which means that probably some of you will just raise your hand, switch on your microphone and hopefully your screen, and shoot. So share your thoughts, ask for immediate clarifications, and use this time to reflect back directly to the lead author. Anupam, I see your hand is raised. Please do go forward.
Hi, thank you very much. I'm Dr. Untitled, joining from Austria. As I understand that this is supposed to be a guideline for most of us, so we can use this as a tool to kind of structure the way we should go forward. However, looking at the model, I feel, very honestly, I feel a little conflicted, because we seem to be talking about a business model as an overhead. And in a lot of situations, I have seen that innovators or stakeholders are using the same terms like creating value, data management for a successful business model, and using something so that we are sustainable. And to me, it poses a kind of ethical, moral question, a very basic one, is that while we are innovating for healthy and active aging, are we looking at it as a service? Are we looking at it as a business process that we're trying to tackle? Are we looking at it as a health challenge? How are we actually defining this? Because I think this sort of will guide the next steps, break down the whole challenge, the context for us, and then that could be the guiding light towards what we are trying to achieve and how. Because to me, personally, I think whatever way we would be collecting, processing, and using data, from the population is sort of the way we will live life into the older age. And that is a question of human value to me,
Yes.
not business value.
Yes, I
So
absolutely,
if
absolutely
this
agree.
is the business, if that's how I think about it, then all these questions that you, very important questions and aspects that you talked about in the whole presentation, and what we are thinking about, like, okay, what kind of data do I collect and process? How do I control it? What are the risks? Yeah, I mean, that kind of gives you the baseline to how to think about those questions, and what kind of, I mean, where to put value when finding answers and solutions. So I would like to hear from Andres on this, actually. Before we begin to the next steps, this is a very, very basic concept to me. And how are we looking at this whole, you know, how are we going to, is it, so I think I'm getting a little vague here. So, you know, there are a lot of trade-offs happening when we are allocating resources. So this was a question in my public health class, like, okay, you have enough fund to save only 100 people. So are you going to save 100 children because they are the future? Are we going to save 100 elderly because they have contributed a lot and we are grateful? Or are you going to allocate resources, 50 older people and 50 children, and the rest of us can die? So just like that, you know, here I'm looking at the business model and data management and everything. So I'm conflicted and faced with this basic question. Okay, so how do I where do I put my basic human value in this? Are we taking care of us? Are we taking care of them? Or did I make myself a little bit clear?
Yes, it makes perfect sense. The term business value is used maybe overreachingly. Actually, we should try to find different word for this in the actual guidebook. But we definitely are thinking of value for organization, whatever value the organization creates. A public service, public organization like a hospital maybe might be, or a regulator, they're not generating business value because there's no money to be generated, but they do add value to the society and the patients and the stakeholders and whoever might be their stakeholders. And we mean exactly that value. And as I said, this is precisely one of the things that we are not going to go into details on because we can't. Because as you rightly say, very often this is about sort of human value. This is about creating value for a patient whose life is basically, you are extending somebody's life, and how do you put a price on that? We don't know. Simply because the models of how do you do this, the ways you approach this challenge are very, very different. So I don't know what the specific answer to your question is, but I do know is that there has to be, the data management in some way has to generate value for somebody. Does it prolong the patient's life? Does it make their life better while it continues? Does it increase the years lived healthily? Different ways to use data there, but something good, something valuable must come out of that data management. And second thing I know is that in order for this model to be sustainable, there has to be some way to capture this value created by prolonging somebody's life, or making the life better, or making the life easier, or making their symptoms a little bit smaller. There has to be a way to capture that value and divert it back into data management? Because is it from a patient? Is it that somebody just volunteers their time? Or is it the donation? Is it the health insurance provider who pays for that? But the simple fact is that the people who do data management and the people who build the tooling that is necessary for data management and the cybersecurity people and so on and so forth, they usually would like to get paid. So how does that happen? And again, and I don't know the specific answer, but I do know that there has to be some mechanism for doing so.
Exactly. And you rightfully pointed out that this guidebook is trying to be specific and general at the same time. And how do you figure out that balance, the fine line? And it is challenging because we are talking about people, number one, and just like any population, the elderly population is a composition of many, many different individuals whose value system is very different and context is very different. So just taking on what you've said, that okay, does it improve the quality of life? Does it prolong somebody's life? And immediately you can see how challenging it is, because as a doctor, I can tell you, longer is not always better. We seem to think so. A lot of us seem to think so, that if we can just prolong life, the lifespan, we must be doing something great. It's not always so. Longer is not always better. So quality of life. What I'm missing within this kind of models is that, yeah, at the top, there's like business value, for the lack of a better word. Maybe we could put quality of life value or happiness value.
Yeah.
These are very good thoughts. And yes, absolutely. I think Andres already answered that the content for this word is definitely of creating benefits, of creating something good coming out of the service. So it's very closely connected to the value proposition that we are accustomed of using the term already with all kinds of services. And naturally, all of the products or services that are there to support, as you say, a longer quality life, living at home, being autonomous, being empowered, and getting the health outcomes that the patients are striving for. These are the benefits. So this is the service really all about. But let's take data management as one of the instruments and then one of the concepts to help create that value. And I wonder if there are any more questions before we can tackle, let's say, the discussion points that we have prepared for today in breakout rooms. So are there any more questions, please, from the audience? Okay. Raise your hand or just switch on your mic and screen and ask. In case there are currently none, then I would say we remain at your service after this meeting is over. And Andres, can you just pull up the slides again to show the contact data, and then also switch on to the discussion questions that we will be tackling and discussing in the breakout rooms. So please make a screenshot or a photo, and the slides will be made available on the website of the IN-4-AHA or Innovation Networks for Active and Healthy Aging, the project that is framing our discussion here. And if you switch on one more, Andres. Thank you. So these will be the questions for today. For today, gathering around reflecting on these three. And there is no harm done if any other item come to your mind when we go into the breakout rooms and can split up and and have a say. But these three are what elements do you feel according to the model that Andres presented are addressed in your organization, and what are the elements that you feel are maybe less addressed or maybe even missing, what you haven't thought about so much until now? You are a service providing organization, you're a health organization, you are any type of organization within this sector. These questions are relevant for each of us. The second question is about the external context that interrelates with whatever we are doing inside the organization. So what are the challenges that you feel that are coming your way, whether you want it or not, in the form of regulations, standards, and have an effect on how health data is used for the delivery of care, for providing your service, for using the services, or for showing the evidence on the benefits and the impact that the health organization is creating. And thirdly, since we do have a lot of diverse stakeholders here, among them are policymakers, are the networks such as innovation boosters, accelerators, technology hubs, reference sites, who are bringing together different types of stakeholders. So let's dwell a bit on this question. Is there a role? Can these kind of facilitators help to maybe boost data management capabilities? Maybe sort out some of the challenges, maybe empower the users to take better use of their data and control it. So let's take these as a base. And now we will be ready to switch to the breakout rooms. You have been divided, since all the questions will be the same, into two parallel groups. So I hope you don't mind when you happen to come into group number 1 or group number 2. Enjoy the time. There are 30 minutes for the discussion, and then we come back to the, let's say, the big room all together here to reflect on the findings. So when we are ready to switch on and split up, then please join the breakout room. Me lähme nüüd ühte.
Without warning, we were pulled back into the main room.
Mid-sentence.
Yes.
Mid-word even.
What happened? I was not going to ask you what age group you are in. Even less now.
Yes, I'm old like the stars.
You're muted, Hila.
And now you should hear my voice together with my face. And I could also hear what you have been talking in the breakout room that I was not lucky to be part with. So I'm glad that you have some fun. And Kaspar has been kind enough to share me your notes, and I will take a couple of minutes and moments to share what was going on in the other breakout room. So definitely the three discussion points or items evoked some of the discussions, but guys, you have so much to share. And first and foremost, let me say that in our breakout rooms, there were a couple of links as resource materials, and we have picked them up. This has been put in the chat, and we can share them with all the participants afterwards, along with the slides and a short memo on what was going on today here. So don't worry, of course you can click them already, but you will get them later in a summary. So starting with the group that you had, you seem to have discussed on the real value, which I think is very, very relevant, because when we are talking about what kind of value data is creating, then we need to start off with asking what kind of value the service is creating. So what is exactly the benefit and the outcomes that the service is trying to achieve, and what is the process to make it happen. And data management is there to, of course, support this process. So you seem to have made the point that there are a lot of challenges coming from external context, usually in the personalized form of local and national laws. Yeah, this is the situation currently. There are a few coming from the European Commissions. There are more regulations that will come from the European Commission, but they definitely won't set everything, you know, on this level. So there are still the regulations that need to be considered, each in our own location. You talked about GDPR, good for you, complicated matter, but you seem to have estimated it as a necessary pain to handle, but local laws are still there. And we know from some of the analysis that the European Commission has made that even GDPR has been applied differently in the member states. So on the third point, the facilitator role and the booster role, that there might be actually a task and the role for accelerators, hubs, clusters, reference sites to actually be the facilitators of contacts between people, the owners of good practices. Also not only data management, but including data management. But why not also give advice on how regulation should be applied, how it has been applied in a good way. And I find it especially amusing that you talked about angel lawyers instead, or on top of angel investors. So these kind of people are very, very much needed to give their legal advice to startups, especially in the initial phases, who are struggling to enter the market and gain users. We talked. I was glad to hear people sharing their context and their lessons learned from being active in startups and services. Of course, the challenges are well listed, many of them. Also very importantly mentioned that technology and using the technology and with the coming generations that we have in the infrastructure and technology is a challenge to be handled. And perhaps this can be also supported by either the facilitators or the policymakers. So how to actually make it all work, again, for the benefit, for the outcome that the services are trying to achieve. And very logically connected to this, this kind of challenges created by technology use and expense of putting all the necessary processes in place and having the necessary people in place brought us into highlighting the role of people, users, who some of them might be very tech savvy, and some of them, of course, not so much. So actually the guidance and the usage of the services offered and the data, how it is handled by the users and by the organizations is a matter of, I would say, boosting capabilities and gaining more knowledge and confidence in that field. There was a talk about good practices repositories, and we will share the links that Merike from EIT Health pointed us towards. So there is a database by biobanks and by accelerators that have very good data collections, data sets already that can be used, that have been made available for use, and perhaps just are not so well disseminated. So not all startups and product owners in the fields can tap into this. Even the pharma industry can be a good point of reference, as they have gone through the rather complicated procedures and can be really resources, but the search on these databases should be carefully thought. So how to actually use these resources based upon the profile of the service that needs this kind of data. So also we talked about well, being empowered enough as a product owner, as a service provider, as a facilitator to work with policymakers and to sort of help them make the right type of regulations that would be not complicate our lives, but make it more doable and actionable, also in terms of data management. And we were also talking about the, of course, the ethical use of data. I can now see in the chat that you have brought it up once more, the ethical committees, but also the correct and suitable way of asking the informed consent of data subjects so that they are really sure what they are giving the consent to. So it was also one of the important points, and I think we can make a promise that this kind of templates will be added to the guidebook. So what kind of issues need to be highlighted when asking the consent or when involving the ethical committee in our work. So I think that was pretty much it from both of the discussions. So you can see also in the chat that it was quite a rich conversation going on. And although maybe it was not presented by me now in a very structured and systematic way, we will go through the notes and the chat here, and we will be glad to hear more from you as we are proceeding, writing up, drafting, finding examples, going through the checklists, making use of the standards such as ISO that are already there, guiding the data management approach. So during the next month, please feel free to reach out to the project and to us, the authors of this guidance. So I don't see any immediate questions now that needs to be responded in the chat. I see a lot of useful recommendations and references. So I think in order to keep up with the timetable, we are ready to close. Piret, would you like to say a few words?
Another step towards guidelines that we really need in our work. So I guess that you already said it, be active in our social media, visit our webpage meanwhile, and stay tuned because there are more activities coming, so you can be part of this process and part of this creating this guidebook. So yeah, stay actively involved, say your opinions, and we are really, I think that we are happy with today's result. Yeah. Sure. Yeah. Today was a good day. So, and yeah, I have nothing more to add. Just stay tuned and actively involved in our activities. So, and wait for the next invitation for the next workshop. So.
Thank you.
Thank you. Yeah.
Contributions.
Thank you. Thank you from my side as well. And see you soon.
Thank you.
Thank you so much. Have a great rest of the day.
Bye.
Bye.